Welcome to the first episode of the Tribal Health Brief, a new mini podcast series from the Intertribal Council of Arizona Incorporated Tribal Epidemiology Center, or ITCA Tech for short. The purpose of this podcast is to give members of our tech team a platform to discuss pertinent data related to the health of American Indians in Arizona, Nevada, and Utah. My name is Ehmer, and I will be your host for this first episode. I am an epidemiologist at ITCA Tech, and one of the areas that I focus on is behavioral health epidemiology. In this episode, we're going to examine some recent trends in fatal and non-fatal overdoses of American Indians and Alaska Natives, or AIAN, in Arizona, Nevada, and Utah. To start off, I'd like to talk about an NPR article that I recently read titled, NPR Exclusive, U.S. Overdose Deaths Plummet, Saving Thousands of Lives, published on September 18, 2024. This article highlights a recent trend in Centers for Disease Control and Prevention, CDC, provisional all-substance overdose death counts, in which fatal overdoses in the U.S. have been steadily declining since the summer of 2023, with the 12-month period between May 2023 and May 2024 representing a 15% decrease in reported overdose deaths. There is currently no consensus on what the drivers of this decrease in overdose deaths may be, or if this trend will continue, but there are some hypotheses. For the sake of brevity, I will not go into detail about some of the potential reasons why overdose deaths might be declining in the US, but if you'd like to read more about that, please see the article titled, Are Overdoses Down and Why? From the University of North Carolina at Chapel Hill Opioid Data Lab, linked in the show notes. Now, it's worth mentioning that even though we see this decrease, overdose deaths remain higher than what they were a decade or even just 5 years ago. For the 12-month period ending in January 2015, there are 47,523 overdose deaths, while the 12-month period ending in May 2024 saw 94,758 overdose deaths, representing an increase of 99%. Now, all this data led me to a simple question. Are we also seeing this trend in AIAN populations in Arizona, Nevada, and Utah? Let's first start with Arizona. I was able to source all the following data from the Arizona Department of Health Services. When just looking at fatal opioid overdoses among AIAN in Arizona, there were 17 in 2018 and 73 in 2023. This represents a 329% increase in deaths. For non-fatal opioid overdoses, there were 59 overdoses in 2018 and 165 in 2023. This represents an increase of 180% in overdoses. Another interesting stat to think about with opioid overdoses is what proportions of overdoses are associated with which substances and how this has changed over the years in Arizona. When looking at non-fatal opioid overdoses in all Arizonans, the proportion of overdoses attributed to fentanyl in 2018 was 9%, and in 2023, it jumped to 69%. While these data are not specific for AIAN, they may provide some insight into the danger fentanyl poses to AIAN communities in Arizona, given the trends seen in state data. So now it's time to look at the most recent all-substance fatal overdose data in Arizona to see if the trends seen in CDC's data is present in AIAN communities in Arizona. When you examine the series of 12-month periods between May 2018 and April 2024, you can see that the period of May 2018 to April 2019 had 30 fatal overdoses. Moving forward to May 2023 to April 2023, this figure increases to 95. However, in the most recent 12-month period I was able to examine, May 2023 to April 2024, there were 79 overdoses, which is a percent decrease of 17% from the last period. So, these data suggest that there may be a recent decrease in overdose deaths in AIAN communities in Arizona, following the national trend. However, as seen with the national data from CDC, overdoses still remain high, even with the most recent decrease, as the percent increase between the first period examined and the final period examined is 160%. Now, let's move on to Utah and Nevada. The state health jurisdictions for Utah and Nevada do not have as robust of an overdose reporting system as Arizona, so data from the following section is sourced from CDC's wide-ranging online data for epidemiologic research, or WONDER database. The most recent data that the Wonder database has is from 2022. So while this won't give us insight into whether or not we can see a similar decreasing trend in overdose deaths in Utah and Nevada, it still gives us an idea of what is happening in Utah and Nevada in terms of overdoses. In terms of all substance fatal overdoses among AIAN in Utah, there were 32 in 2018 and 52 in 2022, which represents a 62.5% increase. In Nevada, there were 17 in 2018 and 34 in 2022, representing a 100% increase. In summary, the most recent all-substance overdose data for Arizona suggests a slight decrease in overdose deaths for AIN, similar to the trend in CDC's national data, while Utah and Nevada cannot be evaluated at this time due to a lack of up-to-date data. It's important to interpret the decrease we see in both Arizona and the national data with caution, as we don't know if this trend will continue and what is driving it. As more overdose surveillance occurs, we have a better idea of the direction in which overdoses are going in. I would also just like to end with saying that the fact of the matter is that overdoses remain high, and that continued effort must be put into harm reduction and overdose prevention in order to see a consistent decrease in overdoses. Thank you for listening to the first episode of the Tribal Health Brief. You can find all of the articles and data sources mentioned in this podcast linked in the show notes. See you next time.